What if I actually shared that what we at times call witchcraft in our African setting is actually a mental health concern that requires attention and treatment? Well, today, let's dive into an understanding of a condition called schizophrenia. My name is Joshua Fred Mangen, a pharmacist at Aculife Pharma, which is one of the leading importers and distributors of pharmaceuticals and cosmeceuticals. Schizophrenia is a chronic and severe mental health disorder that actually affects how a person feels, how a person perceives perceives reality, and actually affects their normal functioning. This is a condition that when we have a patient having this condition, they will have distortions in thought, distortions with perception. They'll have difficulty in coping up with daily stress activities, and in severe conditions, they may have the daily activities affected, and as well as productivity. There are a couple of myths around this condition. I'll just highlight a few, one of which is a misconception that this condition can't actually be treated. And the truth about it is that schizophrenia, much as it's a chronic and severe condition, the patients can actually live meaningful lives with better treatment, with psychosocial support, and all other aspects in that line. The other myth being that this condition is actually caused by poor parenting, yet it actually it has causes that are a bit complex, and these come all the way from environmental factors. They come from other factors such as injuries, and also we have risk factors like substance abuse that do not actually cause the condition, but they predispose one to the risks of getting this condition. The warning signs of schizophrenia at times come unnoticed, and these may include, but not limited to, social withdrawal, lack of motivation in the previously pleasurable activities. We may have disturbances or changes in sleep patterns of this particular person, and we also have reduced emotional expression. The positive and negative symptoms of schizophrenia do not actually bring to our thoughts, or should not bring to our thoughts, that there is a good or bad, but rather these are things that may be added onto this individual as the positive signs, or may be actually withdrawn from this individual if we are to look at the negative signs. And the positive signs here, we may have presentations like disorganized speech, we may have hallucinations, we may have delusions. Delusions here, we're talking about false beliefs. Hallucinations here, the person may see or even hear things that do not actually exist. Then for the negative symptoms, we may have things like reduced emotion in this individual. We may have social withdrawal, and all of these are under the negative symptoms. Schizophrenia, from the previously highlighted symptoms, can be diagnosed if they do actually persist for at least 3 months or more, with a disruption in total function of the individual that can actually present in occupational lack of productivity and very many other activities along with this presentation of symptoms. There is no known complete cause of schizophrenia. However, it is a mix of a number of factors, which include, but not limited to, prenatal factors, environmental factors. We have genetic predisposition, and also we have risk factors that actually predispose an individual to getting schizophrenia as a condition. And these, one of the major outstanding risk factor is substance abuse of compounds such as cannabis. Schizophrenia, being a severe and chronic condition, results into effects that affect an individual, affects the caretakers. So we may have an impact that is profound on the caretakers, even the individual themselves. And here we may see things like lack of, we have hygiene going down in this person that has schizophrenia. We may see them having low emotions. Where we expect them to feel sad, it's the opposite. Where we expect them to be happy, it's actually the opposite. And many of these are effects that we see that may affect this person's relationships, so it is hard for them to even maintain relationships. Whereas schizophrenia is a chronic and severe condition that takes long to treat, we have treatment options available, beginning from psychosocial therapy. We have antipsychotic medications that are available for treating this condition, and many of these are actually combined together, and these patients can live meaningful lives if well treated. Schizophrenia, being a complex condition that involves the interception of neurotransmitters here and there, and many of these medications actually intervene to bring a balance to these. When we have a patient that has stopped taking their medication, the results are actually very clear and are not so good as far as the outcomes are concerned. So we may have a rebound presentation of these symptoms, as we earlier shared. We may have a decline if the person has been trying to progress and maybe their moods are getting better. If they stop their medication, they may worsen to the other side. And all of these come in as something to really put as a serious factor to consider, that once the patient is on their medication, it's important that we support them to actually adhere to their treatments and therapies. Stigma is a very important factor, because many of the times, as we earlier shared about the warning signs, many of the times that the patients having this condition will rarely go and seek for help and assistance, which would actually give us better outcomes of therapy if the treatment is initiated early. So this affects their overall quality of life and also mortality rate, because we know that as their thoughts get distorted, it's a harm to themselves, it's a harm to the people they live with, and in general, it's really a poor prognosis of treatment and the condition itself. Schizophrenia as a condition itself has effects that are profound, as we earlier shared, not only to the patients, but also to the caregivers as well, whose mental status is also affected with time. So it is important that we have support groups where these people come together, they share their experiences, and also share experiences of progress as far as treatment is concerned with their patients, such that we keep their mental health status in check as well. Awareness is one of the interventions that have been in existence for this condition and many other conditions in the mental health care as a whole. And so we have a hope with better treatments coming up. Of course, looking at therapies with a reduced side effect profile, because many drugs in this category tend to have a number of interactions. So with newer drug development of molecules that are safer, we know that at least this is a condition that is being managed world over, and such interventions come in handy. So there is a hope beginning with awareness itself, and this gives us a future to hold on to, that people get aware. Patients with schizophrenia can go to health centers, you can go to mental health units, and it's a very good thing that we have all of these inculcated in our health system. So the treatment alternatives are very available. So these people can get therapy from such facilities. It's important that we raise awareness as far as mental health care is concerned, because our focus is to raise a future where no one is left behind, where every mind is heard, and by so doing, we shall have lesser detrimental effects of such conditions in our society.